Okay, so this is a head-to-toe assessment for nursing 310 and 311. Okay, so first when you have a client, you would ask him what his name is, and then he would say his name. And then you would check for his mood when he's talking to you, if there's any pain or any tenderness in the body. And also you would check if he knows if he's alert, awake, and oriented, so time, place, position, and everything. So first I'm going to inspect the skin, if I can see it, or I can just tell him to take off his clothes. And then I would check for the upper extremities first and see if there's any moisture, lesions, rashes in both sides. And also I would check both of the arms if they are even and symmetrical. And then from there I can go ahead and check for his pulses right here, if they're even, and they are. I can check for the pulses over here as well. And then to check for the epitrochlear lymph nodes, I will go ahead and inspect it right here in the brachial and see if there's any abnormalities. I would check the other side as well, and his are fine. So he doesn't have any lesions, there's no pain, there's no rashes, he's okay. So I will go ahead and inspect his hand. Go ahead, do a hand grip for me. They're equal, they're good. And then I will tell him to close his fingers to see the range of motion, and they're good. And then go ahead and move your wrist. Okay, his wrists are bilaterally moving all together. I will go ahead and tell him to move his arm to check for the strength. I'm going to move it down, push it up. Okay, he's good. Go ahead and pull your arms this way. Okay, the range of motion is good. Go ahead and shrug your shoulder. No, shrug your shoulder up. Okay, so it's good. And they're very strong. So his upper extremities are normal. So I will go ahead and check for the edema. He doesn't have any edema, so he's normal. If there is one, I would have to say if it was +1, +2, +3. And he doesn't have any, so he's normal. And his skin is also normal for his race and ethnicity. Okay, I will go ahead and listen to his lung sounds. Take a deep breath for me. His chest expansion is normal. Okay, good. Go ahead and stand up for me, please. Okay, at this point I'm also going to check for his back and listen to his lung sounds. Go ahead. Take a deep breath for me. Okay, his chest expansion is normal. There's no pain. There's no SLB. I will go ahead and feel his curvature in the spine, and it's normal. There are no nodules or anything like that. Okay, I'm gonna check his back for his kidneys. You have any pain right here in the area? Okay, good. So there's no flank pain or tenderness. Next thing that we are going to check is going to be the carotid, the abdomen, and the apical pulses. So right now you can see his rhythm is normal, and the standard, the deviation from the tracheal are not there, so it's normal. I'll go ahead and inspect his carotid arteries one at a time. Okay. They're normal. Okay. I would go ahead and check for the apical pulses. They are strong, regular rhythm. And then I would go ahead and check for the upper quadrant, going for the lower quadrant first, right lower quadrant. And it can take 5 minutes in each quadrant, but this is present. I'll go ahead and palpate it and see if there's any pain or anything like that, or if it's distended. His is normal. There's no pain. I'm going to go ahead and palpate the client's liver. So it's in the right upper quadrant, and his is not distended. It's normal. It's good. And also, I can palpate the aortic as well and see if there's any pulsations. Okay. Alright, so I will go ahead and ask him to maybe sit down so I can inspect his lower extremities. Right now it's normal, it's even, and I don't see any discoloration in his skin, and his umbilicus is in the midline. It's not deviating, there are no any scars. Okay, go ahead and sit down over here and do it. Go ahead and inspect the skin's hair distribution, the nails, the cap refill. I'm going to go ahead and check that, and then I will go ahead and inspect if the client has any distension of the bladder, and I will ask him if he goes to the bathroom normally. Does he have any pain when he goes to the bathroom? Also, for his lower extremities, I can go ahead and look at it when he's laying down, if he's wearing shorts, or when he's standing up, that's fine too. I'm going to go ahead and check for pulsations bilaterally, if he has any edema. If he doesn't have any edema, his pulses are normal and present and bilateral. I will go ahead and check for the skin, any moisture and temperature. And then I can go ahead and check for the Homan sign as well. So go ahead. Is there any pain?
No.
Okay. So if you don't have any pain, and do the same thing. There's no pain, there's no tenderness, there's no redness. And then from there, I can go ahead and ask him if he can move his knees. Can you move your knees bilaterally? It's fine. Okay, so he can move it up without any problem, and he can move it down too without a problem. So that's good. Go ahead and move your toes for me. Okay, go ahead and move your ankles. Alright, that's fine. Can you feel this?
Yep.
Sensation? Okay, so he has all the sensations in his extremities. And from there, the client can talk to us if he has any pain anywhere else in the body as well. And then from here, I will go ahead and check each leg for any discoloration or anything like that, any scars, especially if it's an elderly, there are any cuts or bruises that I can look at. If it's if the patient is a diabetic, I need to look at the toes really quick and inspect it, because a lot of them can't feel it. Okay, so in this section, we're going to further assess the neurological assessment of the patient. So first, I will ask him to close his eyes, then put his hand up, and then this is called graphesthesia. What is that?
What's that? 6?
Yeah, that's 6. Good job. So therefore, the patient passed. And also, we're going to do the finger test. So go ahead and point to my finger. Where is it? Good. And then we're going to do the finger to nose test. So put your finger on your nose, then put it where my finger is. Okay. There you go. Good job. So he's able to do that. So therefore he passed. And also we're going to do the see how fast his motor skills are. Okay, go ahead and tap your right knee. Right knee. Okay. Tap your right elbow. Good job. Tap your head. Okay. Pull out your index finger on the right. All right. Good job. Okay. So therefore he's able to pass that. So go ahead and flex your hips for me forward. Okay. Go ahead. As long as you can. Okay. Good. Range of motion is good. Now go ahead and move forward a little bit more. Now go go ahead and go backwards. Okay, range of motion is good. Alright, so we're going to go ahead with the Romberg's test. Put your feet together, hands on your sides. Okay, see if there's any deviation. If he doesn't have any, close your eyes. No deviation as well. Alright, that's good. So his balance are good. So now we're going to do the gait and the heel to toe tandems walk. Go ahead, put your heel together, then together like this. Okay. Okay, go ahead and walk backwards. Okay, good. Alright. So from here, since he's standing up, I can go ahead and listen to his aortic, which is about right here. Aortic, pulmonic, herbs, okay, and mitral. Okay, they're strong, normal, non-bounding, in normal rhythm. I can go ahead and check not only the brachial pulses, but also the ulnar pulses, and both of them are +2. No edema, they're normal, bounding, and the rhythm are fine, regular. And earlier I already checked the lower extremities for fetal pulses. So for this client, everything about him is normal. And that's it.